Acid reflux. Is it normal? What is it? And what can we do about it? I'm Dr. Sam Pannick. I'm a consultant gastroenterologist and endoscopist based in Hertfordshire and North London. Acid reflux is the movement of stomach acid upstream into your food pipe. It's normal. We all have it to a small amount because the doorway or junction between our food pipe and stomach isn't watertight. It has to open and close at different times to allow us to move food, saliva, and fluids downstream from the esophagus into the stomach. We can measure in normal people how much acid their food pipe will be exposed to over the course of a normal day. But we know that many people, perhaps 10 to even 30% of an adult population, might experience symptoms of reflux. That's where you're aware of a discomfort from extra acid moving upstream from your stomach into your food pipe. And there can be lots of reasons for that. The doorway or junction between the food pipe and the stomach might be getting a bit wider or looser, which we call a hiatus hernia. That's very common. But other factors can include the types of food or drink that you're taking, the way that you're eating, or other factors like if you're carrying extra weight, that extra body weight will be pressing down on the stomach and forcing it to release some of its contents upstream into the food pipe. So there are lots of different reasons why you can develop acid reflux and also why you can develop symptoms of acid reflux, because the two don't always go strictly hand in hand. Depending on your personal circumstances, your pharmacist or your GP may have recommended a course of anti-acid treatment if your symptoms are typical and they're not worried that anything else is going on. That might be perfectly appropriate, but we do look out for what we call red flag symptoms. Those are signs that perhaps there's something more to it than just straightforward reflux, or that reflux itself may have started to cause some other problem. So your GP will often ask you if you've developed any swallowing trouble, if you've been vomiting or bringing up blood, if the colour of the poo has changed to a dark or tarry colour, which sometimes suggests that there's a degree of slow internal bleeding, or if you've been losing weight without trying. Any of those things might prompt us to do a further check called an endoscopy. That's a flexible telescope camera, a small, thin, flexible tube which is passed down over your tongue and down into the food pipe and the stomach. It lets us have a really detailed, careful look up close at the lining of the upper digestive system. It's quite a quick test. It normally only takes about 10 minutes. And as with any endoscopy, because it's a visual check, we can tell you straight away what we've seen. If we do need to take any samples or biopsies, those will take several days to come back, but we can usually tell you on the day the overview of what the camera test has shown. Once we've done the endoscopy, we'll have a better idea of how best we need to treat your symptoms. The endoscopy will tell us if there's been any narrowing of the food pipe as a result of acid exposure in that area. It will tell us if there are any early changes called Barrett's esophagus, changes in the cells of the lining of the food pipe as they've started to get used to that extra acid, or even if there's an early cancer that might be contributing to your symptoms. Based on those results, we'll typically look at different lifestyle adjustments to bring that acid discomfort under control. We'll look at different medications to reduce the amount of acid and impact of acid. And sometimes for some people, they'll also want to look at a more invasive option, trying to tighten up the junction between the food pipe and the stomach. And that can sometimes be done by an advanced endoscopy or even keyhole surgery. With all of these things, it's really important to be clear, because people will use words like reflux, heartburn, indigestion, chest pain, sometimes interchangeably. And it's really important to pick out what the experience is for you so that we're on the same page and so that we can make sure we're investigating, treating, and helping in the most efficient way possible. If we can help again with reflux or digestive discomfort, as always, please reach out.